And good afternoon. It is time for our regular Friday Lunch and Learn, and I'm so glad you are here with me. Today we're going to talk about fear and the fear factor, okay? So we're not talking about the games that the kids play at church and VBS and all that kind of stuff. We're not talking about that. We're not talking about the TV show about just how grossed out can you get. We're talking about the role that fear plays in our daily life, and are we reactive or are we proactive? So if somebody is reactive, they will respond to what they have been told in a negative way, in a fearful way. That's not what we want to do. If someone is proactive, they're going to respond from a positive viewpoint to fear, and that's what we do want to do. So we need to be making wise decisions, and we need to be very, very proactive. And if we're proactive, we're going to be less controlled by the people that are trying to instill fear in us, because we don't want to be fearful. I think the Bible, of course, y'all know that I'm a Christian and I reference the Bible a lot, but the Bible has, I think it's 365 scriptures that deal with fear. That's one scripture for every day, so we are not to be afraid. Jesus said, let not your heart be troubled, and that means you don't let it be troubled. No matter what you hear, no matter what you see, you are in control of how you respond to things. And so I want you to respond to things. I want you to get a mental intention of, I am going to respond to things on a positive note. I'm not going to respond to things on a negative note. Now, I will just tell you, I'm very proactive. I don't get into fear. I don't like fear. I don't like Fear Factor. I don't ever watch that because that would just gross me out. You know, I just can't deal with that. But also, I have had to turn off the television with the news, the local news, because it was trying to instill fear in me. I would get angry, I would get frustrated because I knew a lot of what we were hearing was not the truth. I do a lot of researching and that kind of thing, and so because of that, I turned off the news, the local news. So true story, a couple of weeks ago, I heard on the radio that this was the 5th named storm in our area this year, and it was like, oh, I haven't heard of any named storms. I guess I better start listening to the local news a little bit. But no, I don't want to be in fear, and so I am shielding myself from negative influences and negative information. I'm still researching, I'm still doing my due diligence, so it's not like I'm not paying attention. I am paying attention, but I am shielding myself from the talking heads that want me to be afraid and want to manipulate my behavior based on fear, right? I don't want to make a behavioral decision or make a health decision based on fear. So the reason I decided to talk to you about this today is because a very good friend of mine is currently babysitting, and has been for the last 2 weeks, babysitting for her great grandchild. And she's doing this because the mom has gone back to work and different things. I don't know what all the ins and outs are, but earlier this week, the mom didn't feel good. The mom went and to the doctor tested her. She tested positive for COVID. And everybody has had a meltdown because what do you do? What do you do? What do you do? And so because my friend knows that I keep aware of things, she reached out to me. What do? I don't know what to do. We've got so much conflicting evidence, conflicting instructions that, I want to do the right thing, but I, not really sure what is the right thing. So this is one reason why I did want to reach out to you guys, because there needs to be some clarity. You'll have, if you're paying attention, there's this decision, and then we switch to the other decision. Then we go back to this decision, then we go the other way, depending on which way the wind is blowing. And we don't want to be that way. Now, I just looked at some statistics because the newborn is a newborn. I think the newborn's about 2 months old. Great grandma is really concerned about, everybody's been exposed because everybody was in the house when mama came and mama left. Mama is COVID positive. So great grandma's been exposed, the baby's been exposed, the daddy's been exposed, the brother's been exposed, so they've all been exposed. So what do we do because we've all been exposed? Do we all have to quarantine? Do we all, what do we do? And it's like, oh, those are really good questions. We don't want to walk around in fear, all right? So the United States statistics as of April, and those are the only statistics I could find, is just through April because they're still compiling statistics. In the United States, the whole total United States, 271 children have died from a COVID infection out of over 3 million, or around 3 million children have come down with COVID. So that is a 0.0090333%. Very small percentage of children have even gotten COVID. And then those that have been sick enough to go to the hospital, they didn't give that stat. But the ones that have died, it's a very under 300 children out of 3 million, under 300. So it's not likely that this little newborn is going to have any problem whatsoever. Yes, newborns do not have very much of a developed immune system, for sure they don't. So we have to be careful with them. But mom is quarantining. Grandma, she does a lot of proactive things, great grandma does a lot of proactive things. So I don't think that she's a carrier or anything like that. She's been tested, she was negative. So I don't think that the baby's in any trouble. But what we want to do is, what can we do to be proactive, okay? So our immune system, we say this all the time, our immune system is the only thing that's going to regain our health, our own body. Your drugs aren't going to do it. Herbs and supplements are going to get your body where it needs to be, but then your immune system is what is going to help you beat a disease. So I just want to remind you how this virus is being spread. It is spread in large droplets from coughing or sneezing. This means that the air is not contagious, all right? You're only contagious if somebody sneezes on you or sneezes on a table or a chair or a doorknob or whatever, and you happen to touch it while it's wet, and then you happen to touch your nose or touch your mouth. That's why washing your hands is very important, and we do advocate for that. We do want you to wash your hands. I'm washing my hands all the time. I'm using sanitizer all the time because you're across the table from me. I'm touching you. I'm evaluating you. I'm doing all that kind of thing. And so if you happen to be positive, then guess what? You could spread it to me. But guess what? I have the mental standpoint that I am not going to get sick. I trust my body. I trust my immune system. I believe that I do what I need to do to stay healthy. And so I do not entertain the idea of, oh my gosh, somebody touched me and I'm going to get sick. I just do not entertain that idea. I have more faith in my own body's natural immunity than I have in the fact that you may or may not be bringing a pathogen into my office, right? That does not negate how we believe about Jesus, and Jesus is the healer and all that kind of thing, right? I'm just saying that is the utmost thing, but I do have a lot of faith in my own body and in my own immunity because of what I do for myself, so I'm not concerned about becoming sick. It says because of this, that they're in the droplets, everything associated with infected people could be contaminated, but you are unlikely to be infected unless your unprotected face is directly coughed or sneezed upon. So this article is written by two doctors, Mark and Michelle Sherwood. They are, one of them is a osteopathic doctor, a medical doctor, and the other one is a functional medicine doctor, and they have a clinic. I'm not sure where they're located, but they have a website, they have podcasts, they have all kinds of things, and they bring healing to a lot of people. So this is their perspective on this, all right? Please keep in mind that exposure to the virus does not equal infection. In some people, the virus is actually prevented from entry. And there are some herbs and supplements that actually will stop the virus from being able to enter into your body and also stop them from being able to replicate. And that's what we want. We don't want viral particles coming in and replicating. Now, I will tell you that as a human being, you have viruses even right now living within you. 95% of adults in the North American continent have the Epstein-Barr virus. It's latent, it's dormant in most people. It comes, it arises, it wakes up, whatever kind of terminology you want to put on that, when you are under stress. Living in fear is a stress response. And so if you have this, and you do, 95% of you do have this virus, if you are operating out of stress, if you're reactive instead of proactive, that virus has a much higher chance of coming out of dormancy, and then you can be in trouble with that. So we don't want to do that. We want you to be happy on that. So there have been a lot of predictions that the whole world's going to die with this virus, and of course we know that that is not true. Every life that has been taken is a precious life, and so we don't want to discount that. I myself have lost friends. I have lost family members, okay? But in most cases, there were comorbidities, all right? A comorbidity is something else that you have that makes your immune system weak, that causes you to be more susceptible to a more serious outcome with this virus. And those comorbidities are diabetes, COPD, cardiovascular disease, and obesity, right? So I don't have any of those comorbidities, and I'm very thankful that I don't. And I do a lot for myself, so I don't have those. And so if you have those comorbidities, you are more susceptible to a more dramatic outcome should you get sick. But you don't have to get sick if you take care of yourself. Change your food, change your lifestyle, change your mental attitude. All those kind of things go a long way in helping our immune system to stay strong. And that's what we want. They say each life is important, but at the same time, and this is what people are missing, this is what the talking heads on TV are missing. At the same time, it is critically important to align our perspective with historical records. The following data are the annual numbers for the leading cause of death in the United States from 2017, provided by the Centers for Disease Control, the CDC. Heart disease was over 600,000. Cancer was right at 600,000. Chronic lower respiratory diseases, what would that be? COPD and other things like that, around 160,000 a year. Stroke, okay, cerebrovascular disease, 146,000. Diabetes, 83,000, almost 84,000. So since these statistics were reported, the numbers have only increased. Contrary to the impression that the news media is giving you, many more people die each and every year from these ailments, many of which are preventable with lifestyle choices. When it comes to the current viral deaths and hospitalizations, the medical community acknowledges that these comorbid conditions, like those above, greatly contribute to the mortality from the virus. Additionally, according to a Harvard University Center study of ethics, about 128,000 people die annually from drugs prescribed by their medical doctors, and they take them the way they are prescribed. So this is medical error. So this is being left out of the compare and contrast, right? Because all we're hearing right now is everybody's dying of the virus. Everybody's not dying of the virus. That's just not truth, but that's what you're hearing, and that's what leads to this fear factor. Now, I have not taken the vaccine. I'm not going to take the vaccine. Don't even try and talk me into taking it, because I'm not going to take it. But my parents have taken it. Why did they take it? Because their doctors recommended that they take it, and also they were tired of being shut in their home, and they wanted to go and do and live their life normally. And they operated under the fact that if I get my vaccine, I don't have to worry about getting infected, because historically, when you take a vaccine, you have the understanding that I'm protected from what I'm going to be exposed to. So we give our children, we don't, but most of the people in the United States give their children the MMR, the DPT, the polio, I think it's in the DPT now, pertussis, all that kind of stuff. They give their children these vaccines. Used to be when I was a little girl, we had 7 vaccines. Now we've got 78 vaccines, right? But we give people the vaccine with the understanding that you're going to take this vaccine, you're not going to get this disease. We know that that's not true because we know in recent years, particularly with measles outbreaks, when they tested the strain of measles, it is the vaccine strain and it's not the wild strain. So that's important to understand. We have a lot of people that will tell you, I had the flu shot and then I got the flu. And that is what happens more times than you can say not, because that's what it does. If you look at the side effects for the flu shot, it is fever, aches, pains, chills, nausea, diarrhea. Well, that's what you get when you get the flu. So it just doesn't make any sense to me, but I digress. Okay, I digress on that. My parents have been going on about their daily lives because they have the vaccine. They've gone about their daily lives as though they don't have a care in the world because they believe that they are protected. Now, we know if we are paying attention, and we talked about this last week because it happened last week. We had several Texas politicians that left the State House and they went to Washington, D.C. And 5 of them, at last count that I read, 5 of them fully vaccinated people. They're all fully vaccinated. 5 of them came down with COVID, fully vaccinated, and then they spread that disease on Capitol Hill, right? So that blows to the wind the fact that you get the vaccine and you cannot get the virus, right? We are under a false sense of security if we think that getting the vaccine is going to help us. Now, what it does do, and what I am grateful for, my parents did not have any bad side effects, so thank you, Jesus, they didn't. Thank you, Renee. There's 6 now that have come down with the virus. Okay, thank you. My parents did not have any of the bad side effects, and they are living their life fear-free. That is very much more better for them, for their immune system to be able to go around their daily life and to be able to live fear-free than to be stuck in their home, being afraid when we come over, being afraid when anybody comes to the door because they were living in fear, right? So we don't want that. None of us want that. It says any population that it increases, we're talking more about the lifestyle changes, any population that increases consumption of refined sugars, chemically altered, highly processed foods, and sleep quality lives in fear. Okay, they will have a less effective immune system and higher disease prevalence. So for the last year, we've been taught to stay away from people, 6 feet of distance, don't go anywhere, don't do anything. So what are we doing? We're home, we're bored, we're depressed, we're eating processed foods, we're eating sugar, we're eating donuts, we're eating whatever we're eating. Okay, so we are weakening our immune system because we're not doing what we need to do. I will just tell you historically, and I learned this in school when we did biology, I learned this in college when I did biology, and I learned it when I was doing holistic medicine. Historically, we've always believed that when you're out and about in the sunshine and coming into contact with other people, they're breathing on you, you're breathing on them, not breathing on, but you're sharing the air, so your body is recognizing things that are not you. That strengthens your immune system because a pathogen is not you. So when we are isolated, when we are 6 feet apart, when we're not going anywhere, when we're not treating our bodies good, we're not getting any exercise, we're having poor sleep because of alcohol abuse or drug abuse or depression or whatever, you're further weakening your immune system. We have known historically that that is true, and it's only in this last situation in the last year that all of that historical medical knowledge has been poo-pooed away, right? When you come in contact with people, you build a resistance to what is not self. A virus is not self. So when we're not allowed to do that, or we're cautioned against doing that, we're setting ourselves up for a weakened immune response. So we don't want to do that. It says there's no secret that immunocompromised people are more likely to have serious outcomes from the virus. On the other hand, those with younger, more robust immune systems generally get sick less, have less severe symptoms, and recover faster. Athletes generally have few symptoms for obvious reasons. So what do we do, right? This is what we want to know. What do we do? We want to make a list of what contributes to poor immunity, all right? Consistent consumption of the standard American diet, consisting of highly processed foods, refined foods, which contain few nutrients and often contain carcinogens. Now, I posted on my Facebook page a couple of weeks ago with these monster drinks. I'm not sure that it was that particular brand, but these energy drinks, there are known carcinogens in the ingredient list. So you guys need to download an app. There's an app that I think it's called Think Dirty, right? And you can put in your product in there and it will tell you what ingredients in there are carcinogens. Also, the Environmental Working Group, and that website is EWG, Environmental Working Group, EWG.org. That gives you a whole lot of information about carcinogens, and this is in your personal care products, your shampoo, your whatever, your laundry detergent, all that kind of stuff. So you've got some resources out there that you can look at and you can say, oh man, I don't want to put carcinogens in my body. And I certainly don't. I don't think I've ever had an energy drink other than coffee. When I was at school years ago, when I was a teacher, when I was a principal actually, a student brought in some chocolate-covered coffee beans. I like chocolate, I like coffee. She gave me some, he gave me some in my hand, and I knew what they were, chocolate-covered coffee beans, but I had never experienced them. I don't know how many I had, maybe 4 or 5, I don't know. Anyway, it wasn't a whole handful, but it was a significant amount. My heart started racing. I liked the taste, but I didn't like what it did to my heart. So guess what? How many times have I done that since? 0. Why is that? Because anything that causes my heart to race out of control is going to wear my heart out, and I'm still fairly young, and I want my heart to continue. So I don't do that, all right? So I don't do things that cause my body to have problems. Lack of adequate sleep. So most people do not get enough sleep. Uncontrolled stress. Stress needs to be controlled, but we're living in a time of uncontrolled stress. Obesity. Obesity is a killer for sure. Remember, we've talked about body mass index. We've talked about waist size. Women, your waist needs not to be larger than 34 inches. And gentlemen, your waist needs not to be larger than 38 inches. So if you are past that marker, then you have a higher risk of mortality. Obesity, diabetes, and if you have diabetes, you're 4 times more likely to be a cancer patient. So we don't want to do that. And all of this is in our control. We control what we eat. We control what our weight is. Yes, we might have to struggle. Yes, we might have to not eat those things that we want to eat and have a little bit of self-control. But if we do that, right, we're going to be just much, much better. So on the flip side, these are some things that you can do to be proactive and help your immune system, all right? Do not live in fear. This will only weaken your system by producing massive amounts of cortisol. Now, cortisol is a hormone that your adrenals put out. It is your fight or flight hormone, and we're thankful that we have it, right? But you don't want it going 24/7. We've got tools here in the clinic. You can do blood work, you can do saliva testing to find out what your cortisol levels are. I will tell you that most people have too much cortisol, and so they're always in that sympathetic nervous system. That's why they are not in parasympathetic dominance. Maintain adequate sleep. You may need to have new sheets. You may need to have new pillows. You may need to have a new bed in order to get adequate sleep. You may need just to turn the TV off and go to bed. You know, sometimes I'm into something and I'm binge watching something and I look up and it's like, oh, I'm past my bedtime. I need to go to bed, right? So we need to do that. Using colloidal silver products to wipe your hands, spray in your nasal passages and mouth, wipe down seats frequented by multiple people. Now, a lot of people were deplatformed on social media for saying this, and it's just absolutely ridiculous because we have a product. It is a silver product. It has a USDA patent, right? It is patented. And in the document, it says it will cure viruses, and it lists specific viruses that it is a cure for. So this is where the misinformation comes from. This is where the censorship comes from. On a USDA patent, this particular silver product kills viruses. And so this would be a good thing to do, and we recommend this as well. Consume sulforaphane yielding broccoli sprouts or powder supplements. They assist the body in repelling viral entry. Take vitamin C as an antiviral. 2,000 to 4,000 milligrams per day is recommended, but always check with your physician. Now, I do want to tell you, vitamin C is very good, but if you're buying vitamin C made in the United States, you are getting genetically modified products, because in the United States, vitamin C is made from corn, and in the United States, corn is almost always genetically modified. So we get our vitamin C from Canada. It is not genetically modified, so I'm just throwing that out there. You want to make sure that you start low on a low dose, even though they say 2,000 to 4,000 milligrams is a good dose. It causes diarrhea. If you're very, very deficient in vitamin C and you take that much, you could have diarrhea. We don't want to do that, right? So you want to start low, start with 1,000 milligrams, see if you can tolerate that, do that for 2 or 3 days, and then go up until you reach that 4,000. Some people even recommend 10,000 milligrams, and I'm okay with that, provided you're not going to have diarrhea, right? We don't want to have diarrhea for sure. Zinc lozenges. These lozenges have been shown to be effective in blocking the coronavirus and most other viruses from replicating in our throat and esophagus. All right, so we know that that's true. I would do 50 to 100 milligrams per day, depending on where you are. There is a zinc tally test that you can do. We can do that here in the clinic if you come by here. And if you can taste the zinc, then your zinc reserves are good. If you cannot taste the zinc, and many people just think it tastes like water, if you can't taste the zinc, then you're highly, highly deficient. Okay, so you want to do that. That's an easy supplement to get. Optimize your vitamin A levels, 5,000 to 10,000 IUs per day. Optimize your vitamin D levels, 5,000 to 10,000 IUs per day. And we do that. We do that. My husband and I do that. We do probably 10,000 IUs every day. And so that just helps keeps your immune system strong. Consume plenty of nitric oxide yielding foods to ensure optimal oxygenation. I can't say that word. Oxygenation. I can't say it. Have more oxygen in your system, okay? Examples are beets and melons. If you do beets, you're going to get a lot of iron, but it's not going to be the constipative kind, okay? So you're okay with that. And melons are really, really good. Eat real food containing fruits and vegetables. When selecting, use the following criteria. Do organic, all right? It says grass-fed, but you would not do grass-fed fruits and vegetables. Fruits and vegetables are not grass-fed. They are from the earth, okay? So that's a kind of a misprint here. They're talking about protein. When you're doing protein, you want to do grass-fed, hormone, antibiotic-free, free range, and wild-caught on your fish. And then you want to enjoy at least, and enjoy is the operative word here, okay? Enjoy at least 3 hours of moderate exercise per week. That's not a lot. Everybody can fit that in, okay? I do it with gardening and different things. So 3 hours of moderate exercise per week, and then become disease confident. Now, I love this, and we started out with this earlier. This means that you do not expect to get sick. You expect to be the healthy majority. And so that's what we're talking about being disease confident. I am confident. I told you last week, a lady came in, hadn't seen her in a while. I asked her if she was huggable. She said yes, she was. So I gave her a big old hug, loved on her. And then she told me, she says, look, she says, I have shingles. I'm like, oh, great, you know. And so did I kind of get into fear and panic? No, I didn't. Why? Because I am confident in my immune system, right? I'm not worried about it. I'm not thinking about it. And it's been over a week. I don't have anything, so I'm just very, very grateful for that. But I believe that my body is good to me because I am good to my body. I eat right. I take the right supplements. I get adequate rest. I get adequate playtime. And I have the right mental attitude. I do not operate in fear. And if I am surrounded by fearful things like the TV, and I'm a news junkie, I love watching the news, right? That's just part of who I am. But I have turned that off almost 100% because I couldn't function the way I want to function with all that negative lie that comes in and talks to me. So just gonna throw that out there. That's what I do. I'm proactive. I want you to be proactive too, because what do? We teach everybody about holistic health. We tell you things that you can do to strengthen your own immune system, because you and you alone can keep your body healthy, okay? That's what we're here to help you with that. It's the weekend. I want you to enjoy your weekend. Get some sunshine if you can. I know it's like blazing hot outside, but get some sunshine if you can, because you need that vitamin D, right? You need that. And then also relax and enjoy your time, because that's very restorative to the soul. It helps you get into parasympathetic dominance, where your body has a chance to relax, recover, feed itself, upload the nutrients that you've eaten and that kind of thing, so that you can be well. I love you guys. Thank you for sharing. Thank you for commenting. Thank you for liking. I appreciate you guys. Keep praying for us, because people don't like what we're telling you. It goes against what the CDC is saying and what the World Health Organization is saying. But we're getting our information from a multitude of doctors. Remember, we said last week, the Great Barrington Declaration, over 44,000 doctors, right? And I think it was about 14,000 public health officials, public health scientists, and that kind of thing. They all are in this declaration, and they're saying all the good stuff, okay? So get your information from qualified sources. We're happy to be one for you. Love you guys. Have a great weekend. See you next week.